All right, we'll get started. Thank you all for joining us for our COVID-19 media briefing. We have Kevin Dick, the District Health Officer for Washoe County Health District, on today. We'll save questions for the end, and as always, you can put them in the chat and we can read them out loud. So, Kevin, if you're ready, please go ahead.
Yes, good morning. Thank you, Scott. Thanks, everybody, for joining us today. The COVID-19 cases in Washoe County, we continue to see a significant increase in new cases that are occurring in the community. We have a record high for our 7-day rolling average of new cases, which is at a little bit over 106 new cases per day that we're having. To put that in some perspective, this is over the number that we had back at the end of July when we had a significant surge that happened. That 106 cases per day represents an 88% increase in the number of cases that we're having per day versus just 2 weeks ago. So we've almost doubled the number of new cases that are occurring over a period of 2 weeks. And so that's a significant cause of concern when we're seeing that type of increase in the cases that are occurring. That indicates that we do have a significant level of disease transmission that's occurring in the community. And we're aware that we do have a significant number of cases that are coming out of the 18 to 24 year age group. The number of new cases per 100,000 people in that 18 to 24 year age group is about 4 to 4.5 times higher than it is for the rates of new cases that are occurring in other age groups. So we do know we have a problem. We do know that we have a number of UNR students that are being reported as new cases, and that these students are going to parties and private gatherings. Recently, I saw pictures from several local bars where people were not practicing the social distancing. The bars were not operating under our standard operating procedures. Saw people lined up shoulder to shoulder at the bar, numbers of individuals sitting around tables that were end to end, not distant 6 feet, not limited to 6 people at a table, etc. Saw pictures of people that were playing pool, which is not currently allowed in the bars. Particularly, I saw these pictures from that were taken at the Record Street Brewery and at Louis Bass Corner. And I understand that these businesses have been issued notices of violation. Understand from the city of Reno that they see in their business inspections problem areas they're seeing are generally seeing in businesses that are around the university area. So I would call for our businesses to comply with the requirements that have been set out for their operations, and for the university students to understand the role that they play in helping to prevent the spread of this disease in our community, and for our university to continue messaging to the students the importance of their behaviors in the outcomes that we see in our community. The number of cases that we're having continually coming in at high numbers every day is taking its toll on our disease investigators and contact tracers. They're falling behind in being able to keep up with the disease investigations for these cases. They're working 12-hour days or more, trying to keep up the best they can. We need our community to understand that we're all in this together, and we need everybody to be working together to beat COVID-19. This isn't something that the health district can do for you. It's something we all have to do for ourselves and for each other, and recognize that we are stretched extremely thin at the health district and are doing the best job that we can as we continue to bring on additional staff. We've increased the staffing of the health district so far by over 60% in our response to the COVID-19 epidemic. We're strained in getting our workstations and phones and computers, et cetera, established. So that's the position we're in, and we really need our community to step up and everybody to do your part to help to prevent the spread of the disease. The governor yesterday made his announcement that he was going to relax public gathering limitations, going from 50 to 250, and to allow larger events to occur. Given the current status that we have in Washoe County, it's in my view not the right time for us to be making these types of increases in gatherings and interactions while we're at our record high for rates of disease. And so I have made a recommendation to the city and county managers that we not increase the limit of 50 for gatherings at this time, as we continue to assess the situation and work to get the spread of COVID-19 in our community under control. With that said, I can tell you that we are reviewing the governor's guidance, trying to understand everything that's been put together as we received this yesterday, and only a quick briefing the evening before the governor's announcement. So we're trying to catch up with what the changes are that have been made to understand all of the different requirements and approaches. We are working again on our second round of seroprevalence testing. And so the testing occurred again yesterday afternoon, and it will conclude today with testing that's going to be going on between 2 and 6. So as you'll recall, this is testing that is for people that were received a letter that was mailed to their household. In order to have a scientific approach, it had to be a random sample through these randomly selected households. So today is the last day to get tested. It's the last day to be able to sign up for this. So if anybody did receive that letter and hasn't responded, it's not too late. Please give us a call at the number on the letter, and we can get you in for testing scheduled for this afternoon to be a part of that project. So Scott, I think that covers my comments, and I'll turn it back over to you.
Okay, thank you, Kevin. If you guys have any questions, please feel free to speak up or let me know in the chat if you have a question. I can read it out loud. Thanks.
Hey,
Hi,
Scott,
go ahead.
Sorry. Do you mind if I go real quick? This is Michael Davis from the Law Review Journal newspaper. Question about the possible exposure data your health district released earlier this week on Monday. Kevin, I just wanted to ask, with this exposure data that you guys are looking at, possible exposure data, how is your health department using that data to shape or enhance its COVID-19 response? And in addition to that, do you plan to continue conducting, such analyses like these exposure data, as we continue on into fall and, continue combating this pandemic?
So there was a great demand for us to release that information. But I'm afraid that it's of limited utility for really doing active intervention for mitigation. And what we see with that data is not where people necessarily were infected, but where people went prior to becoming infected and where they may have gone while they were infected. But that doesn't mean that they're epi-linked to another case that occurred in one of those settings. So we really need to have that individual epi-link of one case to another to be able to see where transmission is occurring and outbreaks. So I think it's important to recognize in the data that we released is to a large part, what you're seeing is places that have more people have more cases. And that's because we're seeing COVID-19 occurring throughout our community. And that's the important message for people to understand is you could contract COVID-19 anywhere that you go when you're out and about. And that's why it's so important to be careful, to be wearing a mask, to be social distancing, to be washing your hands, to be cleaning high contact surfaces, to take those precautions to prevent the spread of the disease, and to recognize that the more places that you go and the more people that you interact with, the greater the chance is that you're going to contract COVID-19.
Hi, Kevin. This is Kenzie with News 4. You seem pretty dissatisfied with the governor's decision. Have you been in direct contact with him? How does that work?
We were not involved in the development of the recommendations regarding the gatherings. We were informed of it, as I said, just shortly before the announcement that occurred. I don't think it's appropriate for Washoe County at this point. I don't know that it's not appropriate for other areas of the state. And what we've seen is that while Clark County had a really high level of disease transmission that occurred over the past several months, they have really had a steep decline in their number of cases, in their positivity. So their community, I think, has responded quite well in helping to prevent the spread of the disease, and we're seeing the results that occurred from that. Unfortunately, what we're seeing in Washoe County is a continued increase in cases to where we're now setting new record levels. So I don't believe that it's appropriate for us here in Washoe County to expand those gatherings at this point. And the governor made it clear in his announcement that we could have more stringent mitigation levels based on the needs of different communities.
Hi, Shuditi from This Is Reno. You mentioned that in bars, the social distancing measures are not being maintained as advised. So does the health district have any plan to work with the bars and pubs?
Well, I'm hopefully messaging to people that they need to comply with the requirements. I mentioned two of the businesses that I'm aware of where that was not occurring. I believe, though, that there are many, many responsible businesses and responsible bar owners that are opening properly and are taking seriously their responsibilities to make sure that people are practicing the precautions. So I think it's important that we focus on businesses that aren't behaving responsibly and following the requirements versus taking action that hurts an entire group of an industry.
Yeah, but is there any plan to maybe reach out to these businesses like one-on-one and get in touch with them? If not generally changing the rules?
Yeah, so the city of Reno has the enforcement responsibility, and as I mentioned, they have cited these businesses with notices of violation for what they observed when they visited them.
Okay, and just one last question, sorry. So about the data, the COVID data from UNR, who updates those data? Is that UNR gives district the data or the district gives UNR the data?
We received the positive test results from students and faculty that test positive for COVID-19. So we have, I think, the most complete picture of the cases, and we also work with UNR and provide that information to them.
So the students, the teachers who are infected get in touch with the district directly? How does that work?
The lab that does the testing and identifies the positive cases provides that information to the health district, and then we follow up with those students and faculty, and then work as well with the university on those.
Thank you.
Hi, Kevin. It's Kenzie again. Excuse me. Obviously, this is really dependent on people being forthcoming and honest, but have you seen any cases linked to the Trump rally?
We do not at this point have any cases linked to the Trump rally. I think we're kind of at the early stage of where we would be seeing those cases. As you said, if people were forthcoming and honest about that.
Kevin, this is Siobhan from the RGJ. Tell me now, after the governor said there could be larger social gatherings, you said you've made a recommendation now to city officials not to do that. What happens now exactly? Will we not have larger gatherings then? Will that not be allowed? Do you have the like the governor said, it's still up to the individual counties. Does that mean we won't have those larger gatherings that he talked about?
So we just heard the governor's announcement yesterday afternoon, and I've been trying to find a time to be able to connect with the managers. I've provided them with my recommendation, and that's where we're at this point.
So the city managers would make that, like the city manager of Reno and the city manager of Sparks?
Ideally, the cities and the county could come together and make a decision for our region as far as what we feel is the best path forward.
And you would do that because the restrictions lifts tonight, right? Or, at midnight tonight. So are you guys meeting today at some point?
As I said, I'm trying to find a time for us to get together.
Okay. And you're trying to do that today?
Yes, I am.
And then you'll issue that because you want the groups to stay below 50.
I think it's very important if we're going to be successful in reopening our economy that we do what we need to do to address the reduction of the spread of COVID-19. And so as the governor said when he made his announcement, he wants visitors to understand that if they're making plans and coming with groups, conventions, et cetera, to visit Nevada, that we're doing this in a safe way and everybody's going to be safe if they're coming and working with our resorts, our economy, et cetera. What we saw with the 1918 influenza pandemic was that the communities that did a good job of working to suppress the spread of disease and the level of flu that was occurring in their communities had a much better rebound with their economic recovery when they did reopen.
And so if you do get to meet with them, the health district would be putting out something later today about the restrictions or keeping things the way they are right now?
We'll see where we end up from that meeting.
When you're listening to the governor last night, do you think you're in a different state? Because you started the meeting with like, we're at 88% higher than we were 2 weeks ago, and you must think, gosh, what state am I in? That we're not the state that's doing. Do you think you must be baffled when you're looking at some of the numbers we have here?
Yes, well, if you look at the state's county tracking numbers, you'll see that the Washoe County is really in the worst position as far as the number of new cases per 100,000 that we're getting. And the fact that we have been increasing the number of people that are being tested for COVID-19 in Washoe County at the same time that we have a rise in our test positivity rate indicates that we do have a very high level of disease happening in the county right now.
You said we're in the worst position, the worst county in the state right now, where the test positivity rate is worse here than in Clark County?
Yeah, we're above Clark County's test positivity rate. We've got the highest number of new cases per 100,000 that are occurring in the state.
Hey there, this is Michael from the Review Journal again. Sorry, I just wanted to get back to the second part of my earlier question, which I wasn't able to get answered on the first go around. Kevin, you mentioned that there was limited utility for doing active intervention from these possible COVID exposure location data. As such, are you guys is your health district planning on continuing to do these analyses on a regular basis, or is it something that you're going to be discontinuing?
I think we're questioning whether it's useful information to be providing to the public. We are trying to capture this information as part of the disease investigation work that we're doing. If it has the potential of leading us to actually epi-linked cases that are occurring, then that gives us a basis for more targeted mitigation at that business. But as I said, this is not data that's providing us with epi-linked information. What we're seeing are just that, you know, people that are out to places that have a lot of people visiting them tend to have people visiting them that then do become sick from their encounter with somebody that was infected somewhere in the previous 2 weeks. And that we see more people going to these places if they do have infections, if there are more people that visit these types of places.
This is Jaden Prez from KUNR. I wanted to ask about the Donald Trump Jr. Campaign stop today. I wanted to ask your opinion of of if you have concerns about the size of the event. And I also wanted to ask, looking at the conditions of approval, it was said that the attendance needed to be less than 1,000 people, but I thought that 250 was the current, or I mean, 50 was the current max, and then 250 was what it was going to be in the future.
Yes, I am concerned about the rally. I know that the city of Sparks has tried to do their best to work with Peterbilt on some controls and measures to help the spread of the disease. But the bottom line is that the governor's directive today is to limit gatherings to 50. And so it's not in compliance with the governor's directive.
This is Siobhan again from the RGJ. How's contact tracing going up at the university? I know you said weeks ago that the school district was kind of a priority for the health district and contact tracing. What's it like right now with, contact tracing all of these young people, this 18 to 24 group?
Well, as I said, we're overwhelmed with the number of new cases that continue to increase and to roll in. So we're falling behind on our ability to connect with people right away and have them isolate. Well, we provide them the isolation information right away, but be able to identify contacts. We're also finding that in the settings where these students are going to parties or in these bar settings where they are right next to one another and not wearing masks, they often don't really know who it is that they're right next to. So the contact tracing is very difficult.
If you had your way, would you tell UNR to go completely full distance and shut down dorms right now?
I don't know what the solution is. I think a number of the students are maybe mostly distance learning. They may be off campus, and so they even without people attending classes on campus, I think we have problems just with people all being together. So if they were to go to distance learning and send everybody home, that might help. But I think that the best situation would be to have their students understand why it's important for them to change their behaviors to help to reduce the spread.
Are most of the UNR students that are being tested, I know they were only testing students who may have come in contact with someone or had symptoms. Do you think a lot of the spread is happening up there because of asymptomatic individuals?
Yeah, it may well be the case. I'm aware of other universities that have opened that have very rigorous testing programs in place with testing everybody multiple times per week, for instance. And there is no program in place like that that's occurring at UNR.
Should there be a program like that?
I think other universities have decided that that's the appropriate approach.
Is there any way that that could be done with the health district, or that would have to be university?
It would have to be the university.
And they haven't been in talks with you to do that or anything?
No, they haven't.
Hi, Shuditi again from This is Reno. I just have one question about the school district, Washoe County School District. Does the health district have the cumulative number of infection and the current numbers, including the faculty, staff, and students?
Um, I believe that we do have a cumulative number. I don't have it on the top of my head. The school district, though, does have a dashboard that they have on their homepage that provides information on cases by age range of the overall population, as well as specific information on cases in the schools, recognizing that all of those children in our community aren't going to the Washoe County School District or maybe distance learning as well.
Well, thank you for that. But currently, we are having a little bit of problem with the school district because they weren't able to provide us with the current data. When we asked them, they directed us to the Washoe County Health District. So I was wondering who is the right person that I should reach out to in the health district to access the data.
Yeah, we can have Scott work with you on that.
Okay, thank you.
Hi, Kevin. This is Laura with Reno Aldea. How are you?
Hi, Laura.
Yeah. How are we doing with the Hispanic testing? Because I know we've been having a lot of quinceañeras, even though we don't have the limit before. You know, like today, like it's gonna be on Thursday, but I know there's a lot of parties going on with the quinceañeras because they're really popular with our community. Are we having any, testing regarding those parties?
I could have Scott look into that. I don't have any information on that just off the top of my head.
Okay.
With all the young people tested, what are some of are there any, are all the cases pretty mild? Is anyone super sick or needing to be hospitalized between that 18 to 24-year-old group?
I don't have the specifics on that. I just know that we have the cases that are occurring. I don't know if we have that granular information or not. We can have Scott look at that.
And the UNR and those cases, is that a big chunk of why we're in this situation right now, would you say?
I believe that's a significant chunk. We've seen a significant increase in cases per 100,000 in the 10 to 19 and the 20 to 29-year-old age ranges that's occurred over the past month or so. But we're also seeing now an uptick in cases in other age groups as well, but not as significant as within those two age ranges. I think what we would expect to see is that as we have more cases that are occurring in high school students and UNR students, et cetera, those individuals are then interacting with others in our community, and will have infections occur in other age ranges because of their exposure to infected individuals that are the students. And so I think that's what we're seeing as well with some of the other increased cases occurring in the community.
What else should UNR be doing besides the students not going out, not having parties? Take the students out of it for a second. What should UNR administration be doing to address this right now?
Well, I think that they've done a lot of work on how they are keeping students safe when they're on the campus and within the classrooms and labs, within the dorms and dining settings. So I don't know what more they can do other than try to get their students to be part of the team working to keep everybody safe.
All right, any more questions for Kevin Dick?
I heard there was a little bit of an outbreak at Minogue and that they shut down their campus. Do you have any information on that?
I'm not aware of that.
Okay.
All right, any more questions? Okay, thanks for joining us. And to those who are expecting more data, please send me an email and we'll get that going for you. Otherwise, we'll see you guys next week, and a recording of this will be available on the website later today. Thanks.